Hi, I'm Dr. Castanet. Today I'm going to explain sciatica and what it is and how to treat it most effectively. Sciatica just means pain in the distribution of your sciatic nerve. The sciatic nerve is a large nerve that starts in your buttock area. It's made up of 5 nerve roots in the lower part of your low back that exit 5 nerve roots on each side. They then coalesce or come together in the buttock region, and then they those nerve roots, L5 through S3, they then are distributed throughout the buttock, thigh, leg, and foot to provide function throughout the whole lower extremity in terms of reflexes, motor function, i.e. muscle function, and sensation of your skin and other components in your leg. It's very common to have pressure on the sciatic nerve root. The pressure typically comes from a disc, which is either bulging or herniated, and putting pressure on one of these nerve roots. I'm going to use a model to describe what I'm speaking about. This is supposed to be a model of vertebrae in your low back. There are discs in between each of the vertebrae. If I turn it on end, this red thing that's migrated out from the center is supposed to represent a bulging or herniated disc. The nerve roots are behind the disc, so that if there's a bulge or herniation of the disc, it very commonly hits one of the nerve roots that makes up the sciatic nerve, and then you will feel pain wherever this nerve root goes. So that could mean the buttock, the thigh, the leg, and the foot. Generally, the further out the disc goes, the more pressure it will put on the nerve root, and the farther down the leg you will feel the pain. When you're treated effectively and you can get this nerve root to go back in that direction and put less pressure on the nerve root, then the pain and symptoms that you're feeling will go in reverse direction, so that as the problem gets worse, it'll go further down the leg, and as the problem gets better, it'll come back up the leg until your symptoms are better. When the nerve root discs, or rather, when the disc bulges and herniates, it's typically the result of many, many years of slow degenerative changes to the outer fibers of the disc, which contain the inner part. And as these fibers degenerate and tear, this inner central component, which is under great pressure, can then migrate through the tears, and then it finally pushes the outermost layers of the disc outward and makes it bulge. The outer fibers of the disc are innervated with nerves so that they feel pain. So when the process first starts and it only involves the inner fibers, you don't feel any pain. When it starts to involve the outer fibers, you'll start to feel pain in the low back area. And then as it involves the nerve root, the pain will radiate down the buttock, thigh, and leg. The most effective way to treat this, and there are several ways, but the most effective way to treat it non-surgically, and it should be the first approach, is to pull the vertebrae apart gently, and when you do that, it reduces the pressure in the disc, and that permits this part, which is under pressure, to go back in this direction and get off the nerve root. Usually if you do that, more than 80% of the time, the person will get relief of their symptoms. It typically requires several treatments to do that. In the olden days, we used traction tables for this purpose. Traction tables were very effective, but they were done typically in hospital settings, which is too expensive to do now. So it's kind of fallen out of favor for that reason, and also because doctors are paid to use other means of treatment which have become more popular, such as epidural steroid injections. And an epidural steroid injection, which is a fine way to treat it on occasion, although it's not the best way to treat it as a first course. But epidural steroid injection injects steroid in this region, which is an anti-inflammatory, because when this nerve, or rather when this disc bulges or herniates and puts pressure on the outer disc fibers as well as the nerve itself, it starts an inflammatory chemical reaction. You can effectively treat that with a steroid injection. But if there's a significant bulge or herniation, the inflammation may just recur. In fact, that's pretty common. Sometimes 1, 2, or 3 injections will be recommended. They may or may not be effective, but it's not the most rational or effective way to treat this most of the time. It's much better to physically improve it, anatomically improve it, by pulling the vertebrae apart with more sophisticated traction tables, which we have now. Well, not many facilities actually have this more sophisticated traction table. And in my 32 years of experience, it's a much more effective means of treatment than other common methods, such as exercises, stretching, things like that. These problems, when they first start to occur, may be self-limited, meaning they may get better with time on their own, which is why sometimes anything you do in the way of treatment will be effective. But if it's a significant sciatic problem with a lot of pain, then you have to undertake some more effective means of treatment. And the most effective means of treatment I've seen non-surgically is this spinal decompression treatment, which is a more sophisticated, effective means of traction. You can get this to go back, get off the nerve root, and more than 80% of people will improve and become fine or essentially fine with this treatment. I send probably less than 5% of people for injections because I may not be able to get them 100% better, or because I may fail, and because they're occasionally surgical. In probably less than 2% of cases, this becomes a surgical issue where it's so far out or so large or so bad and so unresponsive to non-surgical treatment that you have to send them out to surgery, where this part of the disc that's herniated is removed, and that's usually very effective in those circumstances. However, most surgeons will not do that surgery unless you try injections, which is why I do send less than 5% of patients for injections, because there are some patients I can't help with spinal decompression treatment. Those I will send to for injections, because if the injections help, great, and if they don't, that's a requirement to qualify them for surgical treatment in the eyes of most surgeons. I have been doing this spinal decompression treatment the last 13 years. It is the most effective means of treatment non-surgically I've used in 32 years of practice, including 18 years in orthopedics and 5 years in neurosurgery. So if I can help you with your sciatic problem, feel free to call me, 404-558-4015. My website is backstrong.net, and I'm in the Decatur, Atlanta area, and treat everybody throughout the Atlanta metro area. Thanks very much. Bye-bye.